Good morning, everybody. Tuesday the 17th, and just seen my first patient for the day. An interesting case, but very representative of the condition of low back pain, which of course you know I'm very interested in. This lady's 36 and 15 odd years of chronic low back pain, and we spent a lot of time talking about all the treatments that she's had over the preceding 15 years, because you'd imagine that a 36-year-old with a very long history of back pain would certainly have tried lots of things. So at the age of 36, she's of course implementing some lifestyle changes. She's not able to work, she's resting for back pain, avoiding certain activities like housework and gardening. She's not married, so she doesn't have any issues there with family and children. She's using medications, Nurofen, paracetamol, codeine and Lyrica. Hasn't yet moved on to the opioids or those more potent medications, thankfully, but using a lot of these medications, which in themselves are not very good for the bowel, the kidneys and blood pressure. Physical therapy, a lot of physical therapy over the 15 years, a combination of physiotherapy, Pilates, hydrotherapy and core strengthening is a part of the regimen that she's been guided towards. A lot of manual therapy and stretching. And she's now started having some injections, including the facet joints, the epidurals and radio frequency. And one thing I've just left off there is that she's been advised to go and see a dietitian for weight loss, and the advice from the dietitian has been calorie restriction and appetite suppressant medication. No advice there regarding food quality, which is a little bit disappointing. But I'll just turn the board around. These are the questions that I asked her during our consultation. Why have you got pain, and what is the disease causing your pain? And you would have thought that over the last 15 years, with all of the people that have helped her or tried to help her with her back pain, that someone would have actually told her the cause for her chronic persisting back pain. But alas, she did not have any idea as to why she's experiencing so much pain. She mentioned something about degenerative disc disease, but looking at her MRI imaging showed really a very healthy, relatively normal looking spine for a 36-year-old. A little bit of more prominent degenerative disc at L5S1, which just means a little bit of loss of disc height, a little bit of desiccation in the disc, so it looks a little bit dark on the MRI, but certainly no neural compression or any instability that should be reason for her to have chronic persisting back pain. These are just normal changes of the aging spine. So I told her that the answer to those questions was that she was suffering from persistent movement dysfunction, and she looked at me a little bit quizzically. And once I talked to her about the imperatives of movement proficiency to have a healthy spine, she then understood that the most important cure or the most important treatment that has been left out over 15 years is movement therapy. Movement therapy to address the root cause of disease, being movement dysfunction, and then when we reverse movement dysfunction, all of the symptoms that she experiences should start to settle down. and we then will no longer have to keep implementing ongoing use of those medications, injections and lifestyle modifications that she has been doing for the last 15 years. So this is not rocket science, people. It's so simple and so logical when we understand that back pain should be managed like any other disease in the medical industry. Treat the cause in conjunction with controlling symptoms. So absolutely nothing wrong with taking your Nurofen if you've got a back pain, or resting if you've got back pain, but that's not the end of the story. You've got to also address why you've got the back pain, and in 9 out of 10 cases, the most likely cause of the ongoing persisting pain is movement dysfunction. Okay, just thought I'd just share that one with you. Thanks a lot. Bye bye.